Hi guys, in this video we're going to talk about osteoporosis. What is osteoporosis? Osteoporosis is a disease in which the density and quality of bone are reduced. The inside of a healthy bone has small spaces, like a honeycomb. Osteoporosis increases the size of these spaces, causing the bone to lose strength and density. In addition, the outside of the bone grows weaker and thinner. Osteoporosis can occur in people of any age, but it's more common in older adults, especially women. People with osteoporosis are at a high risk of fractures or bone breaks while doing routine activities such as standing or walking. The most commonly affected bones are the ribs, hips, and the bones in the wrists and spine. Osteoporosis occurs when there's an imbalance between new bone formation and old bone resorption. The body may fail to form enough new bone, or too much old bone may be reabsorbed. Two essential minerals for normal bone formation are calcium and phosphate. Throughout youth, the body uses these minerals to produce bones. More than half of all bone is made from phosphate, and small amounts are also used in the body to maintain tissues and fluids. Calcium is essential for proper functioning of the heart, brain, and other organs. To keep those critical organs functioning, the body reabsorbs calcium that is stored in the bones to maintain blood calcium levels. If calcium intake is not sufficient, or if the body does not absorb enough calcium from the diet, bone production and bone tissue may suffer. Thus, the bones may become weaker, resulting in fragile and brittle bones that can break easily. Usually, the loss of bone occurs over an extended period of years. Other factors that may contribute to bone loss, mostly in elders, include inadequate intake of calcium and vitamin D, lack of weight-bearing exercise, and other age-related changes in endocrine functions, in addition to lack of estrogen. Other conditions that may lead to osteoporosis include overuse of corticosteroids, thyroid problems, lack of muscle use, bone cancer, certain genetic disorders, and use of certain medications. So, what are the symptoms of osteoporosis? The early stages of osteoporosis don't cause any symptoms or warning signs. In most cases, people with osteoporosis don't know they have the condition until they have a fracture. If symptoms do appear, some of the earlier ones may include receding gums, weakened grip strength, weak and brittle nails. If you don't have symptoms but have a family history of osteoporosis, talking to your doctor can help you assess your risk. And now we're going to talk about severe osteoporosis. Without an appropriate treatment, osteoporosis can worsen. As bones get thinner and weaker, the risk of fracture increases. Symptoms of severe osteoporosis can include a fracture from a fall or even from a strong sneeze or cough. They can also include back or neck pain or loss of height. And now the diagnosis. To check for osteoporosis, medical history is reviewed and physical examination is done for the patient. Physical examination includes postural changes, loss of height, and bone pain. Also, tests of blood and urine are needed to check for conditions that may cause bone loss. Laboratory testing that needs to be run are complete blood count, creatinine, blood urea nitrogen, calcium, phosphorus, albumin, thyroid-stimulating hormone, free testosterone, 25-hydroxyvitamin D, 24-hour urine concentrations of calcium and phosphorus. Or osteoporosis can be diagnosed by a bone density test. This test is called bone densitometry or dual energy X-ray absorptiometry, DEXA for short. It uses X-rays to measure the density of the bones in your wrists, hips, or spine. A T-score is used to measure if the patient has osteoporosis. Normal bone mass is T-score above -1. Low bone mass, osteopenia, is T-score between -1 and -2.4. And osteoporosis is a T-score at or below -2.5. And now we're going to talk about the treatment. The primary goal of osteoporosis care is prevention. The non-pharmacological treatment for osteoporosis is young adults should be encouraged to achieve normal peak bone mass by getting enough calcium, 1,000 milligrams daily, in their diet, and vitamin D, 600 to 4,000 units. Performing weight-bearing exercise such as walking or aerobics, and maintaining normal body weight, and to limit alcohol consumption and caffeine intake. Smoking cessations helps optimize peak bone mass, minimize bone loss, and ultimately reduce fracture risk. And now, the pharmacological treatments. Biphosphonates are used to prevent the loss of bone mass. Biphosphonate medications include alendronate, risdronate, etidronate. IV zoledronate are indicated for postmenopausal male and glucocorticoid-induced osteoporosis. When taking these drugs orally, it's important to stand or sit upright for 30 minutes after swallowing these medications. Except for ibandronate, you need to stand or sit for 1 hour. This helps decrease the risk of heartburn and ulcers in the esophagus. Also, after taking biphosphonates, you must wait 30 minutes to ingest food, beverages, except for water, and other medications, including vitamins and calcium. Other medications may be used to prevent bone loss or stimulate bone growth. Denosumab is a rank ligand inhibitor and has been more promising than biphosphonates at reducing bone loss. It is administered as 60 milligrams subcutaneously in the upper arm, upper thigh, or abdomen once every 6 months. Calcitonin. Calcitonin is a hormone extracted from salmon that slows bone loss and may increase bone density. It is given as an injection or as a nasal spray. Only women who are at least 5 years past menopause can take calcitonin. It is reserved as a last-line treatment because efficacy is less robust than with other anti-resorptive therapies. Raloxifene. Raloxifene belongs to a class of drugs called selective estrogen receptor modulators, an estrogen agonist in bone, but an antagonist in breast and uterine tissue. It is FDA approved for the prevention and treatment of osteoporosis in postmenopausal women. This medication has been found to provide the benefits of estrogen without many of the risks, although there is still an increased risk of blood clots. Estrogen therapy. Estrogens are FDA indicated for prevention of osteoporosis in women at significant risk and for whom other osteoporosis medications cannot be used. It can be used during and after menopause, and it can help stop bone density loss. Unfortunately, estrogen therapy has also been associated with increased risk of blood clots, heart disease, and certain types of cancer. Testosterone. Testosterone may increase bone mineral density in men with low testosterone concentrations, but has no effect if testosterone concentrations are normal. Teriparatide contains a portion of human parathyroid hormone. It primarily regulates calcium and phosphate metabolism in bones, which promotes new bone formation and leads to increased bone density. The teriparatide dose is 20 microgram subcutaneously once daily in the thigh or abdomen for up to 2 years. General algorithm for management of osteoporosis. Evaluate secondary causes. Non-pharmacological treatments. Dietary calcium 1,000 to 1,200 milligrams daily and vitamin D at least 100 to 800 units daily. Medication therapy. First line, alendronate, risdronate, zoledronate, or denosumab. Alternative therapy, ibandronate, raloxifene, or teriparatide. And last line, intranasal calcitonin. Obtain baseline central BMD testing for monitoring response therapy. And reevaluate BMD using central DXA in 1 to 2 years. Thank you so much for watching, and stay tuned for more videos. And for more information, check out our Instagram. The link is in the description.